Hey guys, so I'm back to do another video on update on the pacer. I know I haven't done one in quite a while. I've been busy recovering and having a few complications. So I ended up I did get approved for the pacer, like I said in the last video. And I had my surgery on February 23rd, 2015, so this year. And I was supposed to be in the hospital for only 2 days, ended up being 8. I had a few complications. I wasn't able to go to the bathroom afterwards, and then that was a whole mess with catheters, and that wasn't fun. And then I was having complications with my blood pressure being low. That's still a problem right now. It's been 7.5 weeks since my surgery, so I'm still having blood pressure issues. They're dipping down into the 70s and 80s and sometimes 90s. So nothing over 100 basically. So that's been really difficult because I haven't been able to drive, and I'm using my walker, and you know, that's been really frustrating. Sorry about the hood. My hair's a mess. So anyways, so I went and saw a cardiologist, and he did an echo test that was normal. And now the next step is to have a tilt table test to figure out why I'm so dizzy and my blood pressure is low all the time. I'm really hoping it has nothing to do with my pacer. I mean, I don't think it does, because I was having issues before, back when I had pyloroplasty in the J-tube in 2013. So I don't think it's that. It might be aggravating it. I have no idea, but so I'm going to have this tilt table test soon, and hopefully that will be able to diagnose me with something or get me on the right track to getting some treatment or something. I don't know. I just would love to get back to driving though, because it's been kind of a burden to ask everybody. I know everybody's like, "Oh, it's fine," but you know, when you've been driving and independent for a long time, and then you have to ask for rides to all these places, it kind of makes you feel cooped up inside, and I don't like that. So besides that, so I went back for my post-op about 2 weeks after my surgery, and I healed up healed up great, so that's good. The incision looks wonderful, and no infection, nothing like that. As far as eating, I actually have tried quite a few things. I can't think of any specifics that I've tried, but basically just stuff that I haven't tried before, and it did seem to be okay. Sometimes it's not, but I still have my GJ tube, so I'm able to vent if that becomes a problem with, you know, I'm not feeling good or whatever. So I have had a few of those already, and that's been interesting, trying to vent with a pacer. For some reason, I don't feel like it vents as well, but maybe it has nothing to do with the pacer. I don't know. Anyways, so other than that, I mean, I have been able, the nausea actually has decreased a lot. I would say on a good week, I would take Zofran, which is my anti-nausea medication, maybe once a week. So if I even feel like doing that, those have side effects of their own, so I try not to take them if I don't have to, but sometimes I have to. So as far as pain goes, you know, as long as I don't bend over quite a bit, I know I'm going to be healing for quite a while. I've heard up to a good year before it's fully healed, but you know, if I bend over a lot during the day, then that's the problem. You know, then I start getting really sore, and I'm trying to stay away from the pain meds. I usually just take ibuprofen or something similar to that. So anyways, what was I saying? Oh yeah. So the pain, it's, you know, it's minimal. It just really depends on how much I'm on my feet and how much bending I'm doing. But yeah, it has, I'm really glad it has healed. So in my hospital stay, like I said, I was in there for 8 days, and that was kind of a nightmare. You know, they were trying to push me out and trying to get me to go home earlier than I wanted to go home. it just was kind of a nightmare. But I ended up writing a letter to them and telling them all about my story and how displeased I was, and that they need to change stuff there. And I actually did get a call from the surgeon personally, which was a huge deal. I was on a natural high after I got off the phone with him, but yeah, that was incredible. He called and he was like apologetic and saying that he read my letter and there's going to be changes at the hospital and how they treat GP patients, and that was wonderful. I was just like, oh wow, my letter actually made a difference. So if you guys have had bad problems at your doctor's office or hospital or any medical profession, I would definitely encourage you to write a letter, because you never know. They said there's going to be changes, so we'll see. They did want me to come back, but I've already switched over to a new GI that I'm going to be seeing on the 21st. So I'm a little nervous about that because I don't know who this GI is, but yeah. So I'm going to go see a whole new team of doctors, and that'll be interesting. I did get my button replaced too, a couple weeks after I had the surgery, and that was, again, a nightmare, but I won't go into that because it was just traumatic. But I'm glad that they apologized, and I hope that other GP patients get good treatment, because that's more important right now. I have a lot of friends that still go there, so anyways, so that's my update for today. I'll try to be on here more regularly. I've just, like I said, been crazy recovering and just no energy, so it's been a little hard to pick up the camera and actually make a video, but I would like to give you guys more updates so you don't have to wait 5 or 6 months in between videos. All right, well, give me a like and subscribe, and if you have any other GP friends that want to follow my vlogs, then please tell them to. So I will talk to you later, guys. Bye.